healthcare providers like clinics and hospitals have struggled with ineffective and expensive procurement barriers that can drive up patient costs and affect healthcare outcomes. When it comes to healthcare procurement and supply chain management, managing the complex web of suppliers, ensuring compliance, optimizing budgets, and maintaining quality while reducing costs can be a daunting task. In addressing these challenges, Nigeria's federal government is training stakeholders in the health procurement and supply chain on how to build efficiency in the system and also cut costs. The federal government organized a one-day technical workshop on May 30th, 2024 at the NAF Conference Center in Jabi, FCT Abuja.
Your presence here today reflects our commitment to build Nigeria's health supply chain efficiency, resilience, and reliability of health supplies procurement, which is in line with President Bola Ahmed Tinubu's renewed hope agenda for health. It is worthy of mention that in our 2024 appropriation, our budget seeks to achieve improved health outcomes for all Nigerians through quality health infrastructure and equipment, trained human resources, improved affordability, and better government. And this is in order to provide quality public service delivery to our citizens. The Federal Ministry of Health has implemented several policies and strategies to strengthen our health products procurement and supply chain system through the years. And this is motivated by the desire to create a patient-oriented supply chain master to achieve high levels of efficiency and effectiveness in the delivery of medicines and other health products to the people of Nigeria.
This workshop, which was co-hosted by the Bureau of Public Procurement and Health Procurement Africa, is also to strengthen healthcare delivery, critically look at the bottlenecks in medical procurement, and come up with sustainable solutions.
What we are doing is to drive improvement in the health sector through improvements in the aspect of capability of public institutions that are involved in health procurement. And what that is supposed to do is to translate to availability, affordability, and access to life-saving health products. And by doing that, we are supposed to contribute to universal health coverage through the work we do. And for us to do this, we are working with a couple of stakeholders. Looking at the work we have been doing so far, we start from the aspect of quantifying of health products. You will agree with me that we can't get procurement very well without understanding our need. And this is one aspect of support we are also providing. And on this, we are working with the states that I've mentioned, as well as the Federal Ministry of Health. But beyond the aspect of quantification, coming to procurement, we are working in this area, starting from diagnosing procurement institutions. And what that does for us is to understand what are those issues that we need to work with them to address going forward so that we can bring about the needed improvements.
What we look after is all the health procurement process strengthening in Nigeria, Kenya and Ethiopia. That's what we're focusing on. And the idea is, as we've said earlier, that this is about increasing the availability, reducing the cost, and making sure that people of Nigeria have access to medicines. As you know, we work in both the state level, federal level and state level. So we are working closely with the DMAs in, as you can see, in eight states so far, and it's increasing their capability in procurement. And again, with the same process strengthening that we're putting in all those states, is that hopefully that will lead them to the greater availability and reduce cost of product. So that people in the more rural areas can access.
With the exchange rates, hardship and high cost of staple foods in the market at an all-time high, many say Events like this are appropriate and we impact the general cost of medical care. Stella Carlo reporting for True Vision Online Television, the platform that democratizes the media space. Don't forget to like, share, comment, and subscribe.